201. What is the most critical side effect to monitor for in a patient receiving midazolam for sedation? Answer: respiratory depression. Rationale: midazolam, a benzodiazepine, can cause significant respiratory depression. Nurses must monitor respiratory rate and oxygen saturation, ensuring reversal agents like flumazenol are available. 202. What is the priority nursing action for a patient with a serum creatinine of 2.5 milligrams per deciliter while on tacrolimus? Answer: notify the healthcare provider immediately. Rationale: elevated creatinine indicates nephrotoxicity, a serious side effect of tacrolimus. Notifying the provider ensures evaluation and possible dose adjustment or discontinuation. 203. What is the most common side effect of bupropion in patients with depression? Answer: insomnia. Rationale: bupropion, an atypical antidepressant, commonly causes insomnia due to its stimulating effects. Nurses should educate patients to take it in the morning to minimize sleep disruption. 204. What lab value should be monitored in a patient receiving pyrazinamide for tuberculosis? Answer: liver function tests, ALT/AST. Rationale: pyrazinamide can cause hepatotoxicity. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation if needed. 205. What is the primary patient education point for a patient prescribed vardenafil for erectile dysfunction? Answer: avoid grapefruit juice to prevent increased drug levels. Rationale: grapefruit juice inhibits CYP3A4, increasing vardenafil levels and side effect risks like hypotension. Educating patients ensures safe use and avoids interactions. 206. What is the most critical adverse effect of warfarin in patients with atrial fibrillation? Answer: bleeding. Rationale: warfarin, an anticoagulant, increases bleeding risk. Nurses should monitor for signs like epistaxis or hematemesis and educate patients to report unusual bleeding. 207. What is the priority nursing action for a patient experiencing confusion while on oxycodone? Answer: assess respiratory status and notify the healthcare provider. Rationale: confusion may indicate oxycodone toxicity or respiratory depression. Assessing breathing and notifying the provider ensures timely intervention, such as naloxone administration. 208. What is the most common side effect of mast cell stabilizers like cromolyn sodium? Answer: throat irritation. Rationale: cromolyn, used for asthma, can cause throat irritation due to inhalation. Nurses should educate patients to rinse their mouth after use to minimize discomfort. 209. What is the primary nursing action for a patient with a sirolimus level of 20 nanograms per milliliter? Answer: hold the sirolimus dose and notify the healthcare provider. Rationale: a sirolimus level above 15 nanograms per milliliter indicates toxicity, risking nephrotoxicity or infection. Holding the dose and notifying the provider allows for dose adjustment. 210. What is the most critical side effect of infliximab in patients with Crohn's disease? Answer: increased infection risk. Rationale: infliximab, a TNF inhibitor, suppresses the immune system, increasing susceptibility to serious infections. Nurses should monitor for fever and educate patients to report symptoms. 211. What is the primary patient education point for a patient starting insulin lispro? Answer: inject just before or immediately after meals to match glucose spikes. Rationale: insulin lispro, a rapid-acting insulin, is timed with meals to control postprandial glucose. Proper timing prevents hypoglycemia or hyperglycemia. 212. What lab value should be monitored in a patient receiving kanamycin? Answer: serum creatinine. Rationale: kanamycin, an aminoglycoside, is nephrotoxic. Monitoring serum creatinine detects early kidney damage, allowing for dose adjustment or alternative therapy. 213. What is the most common side effect of zolmitriptan in patients with migraines? Answer: dizziness. Rationale: zolmitriptan, a triptan, can cause dizziness due to vasoconstriction. Nurses should educate patients to avoid driving if affected and report persistent symptoms. 214. What is the priority nursing action for a patient experiencing leukopenia while on azathioprine? Answer: Notify the healthcare provider immediately. Rationale: leukopenia, a serious side effect of azathioprine, increases infection risk. Notifying the provider ensures drug discontinuation or supportive care like growth factors. 215. What is the most critical adverse effect of long-term gabapentin therapy? Answer: peripheral edema. Rationale: long-term gabapentin use can cause fluid retention, leading to edema. Nurses should monitor for swelling and educate patients to report significant weight gain. 216. What is the primary patient education point for a patient prescribed edoxaban? Answer: take with or without food at the same time each day. Rationale: edoxaban, an anticoagulant, requires consistent timing to maintain therapeutic levels and reduce bleeding risk. Educating patients ensures adherence and safety. 217. What is the most common side effect of second-generation antipsychotics like risperidone? Answer: weight gain. Rationale: risperidone can cause weight gain due to metabolic effects. Nurses should monitor weight and educate patients on diet and exercise to mitigate this side effect. 218. What is the priority nursing action for a patient with a zonisamide level of 40 micrograms per milliliter? Answer: hold the zonisamide dose and notify the healthcare provider. Rationale: a zonisamide level above 30 micrograms per milliliter indicates toxicity, risking CNS effects like confusion. Holding the dose and notifying the provider allows for dose adjustment. 219. What lab value should be monitored in a patient receiving long-term celecoxib therapy? Answer: serum creatinine. Rationale: celecoxib, a COX-2 inhibitor, can cause nephrotoxicity with long-term use. Monitoring serum creatinine detects early kidney damage, prompting dose adjustment. 220. What is the most critical side effect of cetuximab in cancer treatment? Answer: infusion-related reactions. Rationale: cetuximab can cause severe infusion reactions, including anaphylaxis. Nurses should monitor closely during infusion and have emergency medications ready. 221. What is the primary nursing action for a patient experiencing angioedema while on ramipril? Answer: discontinue ramipril and notify the healthcare provider immediately. Rationale: angioedema, a potentially life-threatening side effect of ACE inhibitors like ramipril, requires immediate drug discontinuation and provider notification to prevent airway compromise. 222. What is the most common side effect of loop diuretics like bumetanide? Answer: hypokalemia. Rationale: bumetanide increases potassium excretion, leading to hypokalemia, which can cause muscle cramps or arrhythmias. Monitoring potassium levels is essential. 223. What is the priority patient education point for a patient starting adalimumab for psoriasis? Answer: monitor for signs of infection, such as fever or sore throat. Rationale: adalimumab, a TNF inhibitor, increases infection risk. Educating patients to report symptoms ensures timely intervention to prevent serious infections. 224. What is the most critical adverse effect of terbutaline in patients with asthma? Answer: tachycardia. Rationale: terbutaline, a beta-2 agonist, can stimulate the heart, causing tachycardia. Nurses should monitor heart rate and educate patients to report palpitations. 225. What lab value should be monitored in a patient receiving everolimus? Answer: lipid levels, cholesterol, triglycerides. Rationale: everolimus, an immunosuppressant, can cause hyperlipidemia. Monitoring lipid levels ensures early detection and management with statins or lifestyle changes. 226. What is the primary nursing action for a patient with a felbamate level of 100 micrograms per milliliter? Answer: hold the felbamate dose and notify the healthcare provider. Rationale: a felbamate level above 80 micrograms per milliliter indicates toxicity, risking aplastic anemia or hepatotoxicity. Holding the dose and notifying the provider allows for dose adjustment. 227. What is the most common side effect of fibrates like gemfibrozil? Answer: gastrointestinal upset. Rationale: gemfibrozil can cause nausea or dyspepsia. Nurses should educate patients to take it with food to reduce GI irritation and report persistent symptoms. 228. What is the priority nursing action for a patient experiencing tardive dyskinesia while on quetiapine? Answer: notify the healthcare provider immediately. Rationale: tardive dyskinesia, a potentially irreversible side effect of antipsychotics like quetiapine, requires prompt provider notification for dose adjustment or discontinuation. 229. What is the most critical side effect of long-term nifedipine therapy? Answer: peripheral edema. Rationale: nifedipine, a calcium channel blocker, causes vasodilation, leading to fluid accumulation. Nurses should monitor for edema and educate patients to report swelling. 230. What is the primary patient education point for a patient prescribed amoxicillin? Answer: complete the full course of antibiotics to prevent resistance. Rationale: incomplete antibiotic courses can lead to bacterial resistance. Educating patients ensures adherence and effective treatment of infections. 231. What lab value should be monitored in a patient receiving posaconazole? Answer: liver function tests, ALT-AST. Rationale: posaconazole, an antifungal, can cause hepatotoxicity. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation. 232. What is the most common side effect of NMDA receptor antagonists like amantadine? Answer: dizziness. Rationale: amantadine, used for Parkinson's, can cause dizziness due to CNS effects. Nurses should educate patients to avoid falls and report persistent symptoms. 233. What is the priority nursing action for a patient with a oxcarbazepine level of 40 micrograms per milliliter? Answer: hold the oxcarbazepine dose and notify the healthcare provider. Rationale: an oxcarbazepine level above 35 micrograms per milliliter indicates toxicity, risking hyponatremia or seizures. Holding the dose and notifying the provider allows for dose adjustment. 234. What is the most critical side effect of docetaxel in cancer treatment? Answer: neutropenia. Rationale: docetaxel can cause severe bone marrow suppression, leading to neutropenia and infection risk. Nurses should monitor CBC and educate patients to report fever. 235. What is the primary nursing action for a patient experiencing hyperglycemia while on olanzapine? Answer: notify the healthcare provider immediately. Rationale: olanzapine can cause hyperglycemia, especially in diabetic patients. Notifying the provider ensures glucose monitoring and possible insulin or dose adjustment. 236. What is the most common side effect of tricyclic antidepressants like imipramine? Answer: anticholinergic effects, dry mouth, constipation. Rationale: imipramine blocks acetylcholine, causing dry mouth and constipation. Nurses should educate patients on hydration and fiber intake to manage symptoms. 237. What is the priority patient education point for a patient starting liraglutide for diabetes? Answer: report severe abdominal pain, which may indicate pancreatitis. Rationale: liraglutide, a GLP-1 agonist, can rarely cause pancreatitis. Educating patients to recognize and report symptoms ensures prompt medical intervention. 238. What lab value should be monitored in a patient receiving long-term phenytoin therapy? Answer: complete blood count, CBC. Rationale: phenytoin can cause bone marrow suppression, leading to anemia or leukopenia. Monitoring CBC detects early hematologic toxicity, prompting dose adjustment. 239. What is the most critical side effect of clozapine in patients with schizophrenia? Answer: agranulocytosis. Rationale: clozapine can cause a severe drop in white blood cells, increasing infection risk. Regular WBC monitoring is required to detect this life-threatening side effect. 240. What is the primary nursing action for a patient with a vancomycin trough level of 22 micrograms per milliliter? Answer: hold the vancomycin dose and notify the healthcare provider. Rationale: a vancomycin trough level above 20 micrograms per milliliter increases the risk of nephrotoxicity and ototoxicity. Holding the dose and notifying the provider allows for dose adjustment. 241. What is the most common side effect of thiazolidinediones like pioglitazone? Answer: weight gain. Rationale: pioglitazone can cause fluid retention and fat accumulation, leading to weight gain. Nurses should monitor weight and educate patients on lifestyle modifications. 242. What is the priority nursing action for a patient experiencing serotonin syndrome while on paroxetine? Answer: discontinue paroxetine and notify the healthcare provider immediately. Rationale: serotonin syndrome, caused by excessive serotonin, is life-threatening. Stopping the drug and notifying the provider ensures supportive care and symptom management. 243. What is the most critical adverse effect of streptomycin in patients with tuberculosis? Answer: ototoxicity. Rationale: streptomycin, an aminoglycoside, can cause irreversible hearing loss or balance issues. Nurses should monitor for tinnitus or vertigo and report symptoms promptly. 244. What is the primary patient education point for a patient-prescribed salmeterol inhaler? Answer: use as a maintenance therapy, not for acute asthma attacks. Rationale: salmeterol, a long-acting beta agonist, is for prevention, not rescue. Educating patients ensures proper use and reliance on short-acting inhalers like albuterol for acute symptoms. 245. What lab value should be monitored in a patient receiving long-term risperidone therapy? Answer: fasting glucose. Rationale: risperidone can cause hyperglycemia and diabetes risk. Monitoring fasting glucose detects early metabolic changes, allowing for lifestyle or medication adjustments. 246. What is the most common side effect of alpha-1 blockers like prazosin? Answer: orthostatic hypotension. Rationale: prazosin causes vasodilation, leading to blood pressure drops upon standing. Nurses should educate patients to rise slowly and monitor for dizziness. 247. What is the priority nursing action for a patient with a hydromorphone overdose? Answer: administer naloxone and monitor respiratory status. Rationale: hydromorphone overdose causes respiratory depression. Naloxone reverses opioid effects and monitoring ensures airway protection and adequate ventilation. 248. What is the most critical side effect of oxaliplatin in cancer treatment? Answer: peripheral neuropathy. Rationale: oxaliplatin can cause nerve damage, leading to numbness or tingling. Nurses should monitor for neuropathic symptoms and report them to prevent progression. 249. What is the primary nursing action for a patient experiencing a rash while on sulfamethoxazole? Answer: discontinue sulfamethoxazole and notify the healthcare provider immediately. Rationale: sulfamethoxazole can cause severe hypersensitivity reactions, including rash or Stevens-Johnson syndrome. Stopping the drug and notifying the provider ensures urgent care. 250. What is the most common side effect of decongestants like pseudoephedrine? Answer: nervousness. Rationale: pseudoephedrine, a sympathomimetic, can cause CNS stimulation, leading to nervousness or insomnia. Nurses should educate patients to avoid taking it late in the day.